As nurses working in the Philippines, it is important for us to be familiar with our nursing ethics. Nursing ethics refers to the moral principles that guide nursing practice in decision making. It ensures that nurses act in ways that protect patient dignity and uphold professional integrity. Ethical considerations are particularly important in the Philippines, where healthcare access, disparities, and cultural values shape decision making. The Code of Ethics for Registered Nurses in the Philippines is established by the Board of Nursing under the Professional Regulation Commission, or the PRC. It is guided by Republic Act 9173, known as the Philippine Nursing Act of 2002, which upholds ethical nursing standards. The Code of Ethics emphasizes professional responsibility, integrity, patient-centered care, and respect for human dignity. Ethical guidelines help nurses navigate moral dilemmas, particularly in government hospitals where resource limitations may pose challenges. What are the ethical principles in nursing? First, we have autonomy. Nurses must respect a patient's right to make their own healthcare decisions, even if it contradicts medical advice. Beneficence. Nurses should always act in the best interest of patients, promoting well-being and recovery. Non-maleficence. Nurses must avoid harm to patients, which includes preventing medication errors and ensuring safe healthcare environments. Justice. Equal and fair treatments should be provided to all patients, especially in our healthcare delivery system, where there are disparities in access to healthcare services. Fidelity. Nurses must maintain trust with patients by honoring confidentiality and upholding commitments. Veracity. Truthfulness is essential in all professional interactions, including delivering difficult news to patients and their families. Ethical dilemmas in nursing often arise from conflicting responsibilities toward patients, healthcare institutions, and the professional regulations. Technological advancements create new challenges, such as end-of-life decision-making and the ethical implications of artificial intelligence in healthcare. In the Philippines, issues of fairness in resource allocation are significant, as many government hospitals face shortages of medicines, equipment, and trained staff. Nurses often struggle with maintaining ethical standards while working in under-resourced healthcare facilities. What are common ethical issues in Philippine nursing practice? 1. Informed consent. Our patients must understand and voluntarily agree to procedures, but in some hospitals, language barriers and lack of education may pose challenges. End-of-life decisions. Nurses often handle do not resuscitate or DNR orders and palliative care, balancing ethical concerns with cultural beliefs about death. Patient confidentiality. Maintaining privacy is critical, especially in Filipino culture, where family involvement in medical decisions is common. Resource allocation. Government hospitals and rural areas often face shortages, forcing nurses to make difficult decisions about prioritizing care. How do nurses make ethical decisions? Nurses should identify the ethical dilemma by recognizing situations where moral principles conflict. Gather all relevant facts to fully understand the situation, including patient preferences, legal considerations, and institutional policies. Consider the Philippine Nursing Code of Ethics as a guiding framework. Evaluate all possible options and their consequences before making a decision. Once a decision is made, implement in a way that upholds ethical principles. Afterward, reflect on the outcome and identify improvements for future ethical decision making. There are some strategies to enhance ethical practice. Continuous ethical training and education should be mandatory for nurses to keep up with evolving ethical challenges. Hospitals should have ethics committee where nurses can seek guidance when facing moral dilemmas. Open communications between nurses, patients, families, and healthcare team fosters trust and ethical decision making. Nurses should advocate for patients' rights and ethical nursing practice, particularly in underserved communities. Strengthening professional accountability ensures that nurses adhere to ethical standards despite challenges in the healthcare system. Nursing ethics plays a crucial role in decision-making, patient care, and professional integrity. We nurses face ethical dilemmas daily, influenced by medical advancements, legal policies, and cultural expectations. Some of these issues are highly sensitive, such as confidentiality, end-of-life care, and reproductive health. Understanding ethical principles helps nurses make informed and compassionate decisions. Ethical dilemmas in the Philippines are shaped by religious, cultural, and socio-economic factors. Nurses often struggle with issues related to patient rights, professional responsibility, and access to health care. The Philippine Nursing Act of 2002, or RA 9173, provides ethical guidelines to ensure high standards of nursing practice. A major ethical challenge is balancing patient confidentiality with public safety in HIV/AIDS cases. Nurses are legally and ethically obligated to protect patient privacy, as stated in the Philippine HIV and AIDS Policy Act, or RA 11166. However, there are cases where disclosure may be necessary to prevent the spread of infection. The role of nurses is to provide non-judgmental care while ensuring ethical and legal compliance. Abortion is illegal in the Philippines, except when necessary to save the mother's life. This presents an ethical challenge. How can nurses provide care without violating the law or their personal beliefs? Nurses must educate and support women about legal reproductive health services and family planning. They need to provide non-judgmental and compassionate care. Organ transplantation raises ethical concerns related to consent, allocation, and financial disparities. The Organ Donation Act, or RA 7170, regulates the ethical donation of organs in the Philippines. Nurses must ensure that patients and families fully understand the implications of organ donation. There is also a need to prevent illegal organ trade and exploitation of vulnerable individuals. DNR orders, or do not resuscitate orders, and palliative care are sensitive ethical issues. Many Filipino families struggle to accept end-of-life decisions due to cultural and religious beliefs. Nurses must act as mediators, ensuring that patients' wishes are respected while also supporting the family's emotional needs. Ethical nursing care includes pain management, emotional support, and respecting the dignity of dying patients. Some hospitals in the Philippines lack resources, including hospital beds, medications, supplies, and staff. This leads to ethical dilemmas. Who should receive treatment first? The ethical principle of justice guides nurses in ensuring fair distribution of healthcare services. Nurses need to be transparent, compassionate, and objective when making these difficult decisions. In today's digital world, protecting patient privacy is more challenging than ever. Nurses must follow the Data Privacy Act of 2012 or Republic Act 10173 to prevent unauthorized sharing of patient information. Ethical nursing practice requires strict confidentiality, especially in public hospitals where record keeping may be less secure. Advocacy is the process of standing up for patients and ensuring they receive quality care. Nurses in the Philippines often advocate for patients' rights, fair labor practices, and healthcare policy improvements. Through advocacy, nurses become leaders in promoting ethical and effective healthcare delivery. Nurses must inform patients about their rights and healthcare options. Supporting patient autonomy means respecting their choices even when they refuse treatment. Nurses act as mediators, ensuring that patients' needs are heard and met by healthcare providers. Nurses can influence policy change to improve working conditions and healthcare standards. The Philippine Nurses Association plays a key role in advocating for fair wages, safe working environments, and improved healthcare policies. Nurses also participate in health education campaigns to empower communities with knowledge about disease prevention and health promotion. Heavy workloads and lower salaries often prevent nurses from engaging in advocacy. Many fear retaliation or job loss when speaking out against unethical practices. Despite these challenges, nurses must continue to push for reforms that benefit both patients and healthcare professionals. What are strategies to strengthen nursing advocacies? 1. Strengthen ethical education for nurses to improve awareness of advocacy rules. Form alliances with professional organizations like the Philippine Nurses Association and the Department of Health to influence healthcare policies, encourage patient participation in legislative advocacy, to push for reforms that improve working conditions and patient care. Ethical issues in nursing require critical thinking, compassion, and adherence to ethical principles. Advocacy plays a crucial role in protecting patients' rights and improving nursing profession. Filipino nurses must continue to be champions of ethical and patient-centered care.